The study was conducted since over the past 10 to 15 years, introduction of novel, highly active agents into the therapeutic armamentarium for multiple myeloma has dramatically increased the rate of CR and extended progression-free survival and overall survival. Therefore, this highly novel agent have questioned the role of upfront autologous stem cell transplantation for younger and fit myeloma patients. The study is a phase 3 randomized trial. Was conducted by the European Myeloma Network and is the largest so far reported, since 1,500 patients were registered. Eligibility criteria were those of every study comparing and exploring the role of autologous stem cell transplantation. That means an upper age limit of 65 years, absence of comorbidities, and so on. The study was primarily designed to compare autologous stem cell transplantation, either single or double, versus a chemotherapy alone, including bortezomib. And for this purpose, bortezomib, melphalan, and prednisone was chosen as the reference treatment. The results presented at ASCO were related to a first pre-specified interim analysis that was performed this year. At that time, the median follow-up was 26 months. Median PFS was not yet reached for patients who were randomized to high-dose intensification therapy with autologous stem cell transplantation, while it was 44 months for patients who were randomized to chemotherapy alone, including bortezomib. The difference between the two treatment arms was statistically significant in favor of upfront autologous stem cell transplantation. Progression-free survival benefits with autotransplant versus chemotherapy alone was retained across certain subgroups of patients at low and high risk, including patients with a low and a high risk cytogenetic profile. For both these patients, randomization to upfront autotransplant was associated with a 30% relative reduction in the risk of progression or death as compared to the standard intensification arm with VMP. In terms of adverse events, it happened what could be reasonably expected. This means that the autotransplant arm was associated with a higher frequency of hematologic toxicity. That was the expression of sub-myeloablative doses of melphalan, with a high rate of gastrointestinal adverse events and infections. However, the rate of patients who died due to the transplant procedure was less than 2%. Autologous stem cell transplantation still continues to be the reference treatment for younger and fit myeloma patients, even in the novel agent era. This conclusion comes from a preliminary analysis. We need to support this conclusion with a longer follow-up. However, the preliminary results underscore the need to not abandon autotransplant even in the novel agent era.